Good morning, and
We'll ask our other
thank
folks to come
you
up.
so much, both panels 5 and 6,
Great job.
as Lori and Anthony and Ellen make their way here. For those of you who are new this morning and weren't here yesterday, let me just say I'm Celeste Clark, and I'm a member of the Standing Committee as well. And the way this town hall is going to work, and this is the third and final town hall, so I can say with confidence we are really in the home stretch. And so what I'd like to do is just to say that the way this is going to proceed is that we will first have a Q&A. So I see some people already lined up at the microphones. And then after we have the Q&A with our panelists, we will then also have prepared remarks by those who've indicated they'd like to make them, and if there's any comments that others of you would like to make at that time, that would be appropriate. But before we get started, we have this strong desire. You see this quartet over to my right, and we'd like to serenade Lori. So let us begin with happy birthday. Happy birthday to you. Happy birthday to you. Happy birthday, dear Lori. Happy birthday to you. Okay. Very nice. Okay. So let me just say that this workshop, Creating Equal Opportunities for a Healthy Weight, really has been tremendous. We've had some excellent discussion and really some encouraging progress on challenges that we see regarding health disparities as it pertains to obesity, particularly childhood obesity. And I think this morning the two panels focusing in on the messaging environment and the school environment, really you've given us plenty of things to think about. And it's interesting because a lot of our discussion has gone from the clinical setting to really a community and a school-based setting. So I really would say that you've done a phenomenal job in bringing some insights before us this morning for us to engage in. And what I'd like to do is just get our folks who are here to ask questions. I'll give you the first shot at it, and then I'll come back with some to fill in. Okay, over here to my left.
Thank you. And thanks for a great panel again today. I'm Nicole Keith. I'm from Indiana University, Purdue University, Indianapolis. I have a concern, and that on panel 5, the messaging strategies 2 through 4 only addressed nutrition, and then on panel 6, only one of the 3 messaging strategies addressed physical activity. And so I felt as though, and I'm a physical activity researcher, and I felt as though I was going back a couple decades ago when the strategies to address obesity only involve nutrition behavior. And so I would really like to ask, what are the plans in terms of the Ad Council, in terms of other advertising, in terms of school systems, to also include education about physical activity, to include messaging strategies about physical activity, and then also this new concept of sedentary behavior in order to get messages across to our children that we don't want them sitting for even 60 minutes at a time, that it's unhealthy for them, and that it challenges us on the obesity spectrum.
Okay, who wants to take that start off?
Well, the Let's Move campaign, if you want to talk about that, was about getting kids up and moving in physical activity. And there are recommendations that we should increase messages about physical activity. But I think you're right, there has been an imbalance when we talk about advertising and marketing. In a sense, the kinds of media that one uses to distribute these messages lead children to lead more sedentary lives, and that certainly is a concern that's been expressed by families and parents, and it also does appear in the APOP, but I did think that Anthony talked about an advertising campaign to get kids moving. I don't know of many advertising campaigns, although Common Sense Media has something like that, to tell children to turn off the set and go outside and to do other things.
Anthony, do you have any further comments?
The only thing I would add is, I would say in my experience in working in this space, it's actually been easier for us to get partners who want to talk about the physical activity message, and a little bit more difficult to talk about nutrition because it is so complicated, because there are so many competing messages in that space. So we're continuing to pursue, as I said, the campaign that we have is going to end at the end of this month, but we'll continue to pursue campaigns, and I would pretty confidently say that we will have a physical activity message out there. And I agree, some of the challenges when using this type of medium to communicate a physical activity message is that, in fact, most of the time you are sedentary when you're consuming this media. That being said, a lot of the work that we've done, whether on the research into developing the message or on the outcome of the message, has been to balance this idea of going to a website to maybe learn some information, or to find ways to be more physically active, and then incentivizing kids, families to go away, to come back and maybe report on it, but to, again, get away from the screen, so to speak.
I think I might just add from the perspective of the balance of caloric intake versus caloric expenditure. We've got more concrete caloric measurement on the nutritional intake side than we do on the caloric expenditure side, and so I think bringing that forward so that we can actually have a better measurement set and know what the balance of expenditure and intake is. I almost harken back to tobacco in the 20th century was a relatively easy battle in retrospect because you could point to the target that was causing damage and actually mobilize against it. We're a little farther along on nutrition because we can count the calories. We frequently don't, but we can count the calories. It's a little harder on the expenditure side and to build that capacity. I would also add for society, I mean, and part of, we didn't mention it today, but the active applause you have at the end of each person's discussion is so that we are more physically active than we otherwise would be sitting down for 4 hours straight without a break today. So clearly an important component, a critical component in the balance, and a need for continued efforts to expand our understanding.
Thank you so much. Thank you. The next question, please. Leanne, you want to go? Or Bill, you were there first.
Thanks. Bill Deeds, Standing Committee. Ellen and I had a discussion about engagement earlier today, and it's a theme that runs through all of the presentations, which were really excellent. Thank you all for your comments. But I wondered if you could comment on the advertising side, what kind of strategies we should begin to employ to engage parents particularly, and other caregivers around the issue of advertising, food marketing aimed at children. And on the child and adolescent side, how do we create what additional steps do we need to take to engage those children and adolescents, both in the kind of planning that you do, Rodney, in your schools, and you've done so well in California with CanFit. How do we expand that and link both the advertising that really exploits children and adolescents to these other areas of engagement?
Well, my first question back to you, Bill, is what do we want to engage them in? And you don't have to answer. I'm being rhetorical.
No, the question is, if we're going to change things, we really need to create a sense of outrage and exploitation. Right. How do we do that?
That's right. And that's what I mean, because we don't want to just engage them in feeling bad about what this bombardment is against them and their kids. And they're not always in the position to do something about it. I mean, for a lot of parents, it's easier to leave your kids home than take them down the cereal aisle. So that's really not fair to parents because they're not the ones making decisions about what's on the front of those packages. So along with figuring out how to explain to them what the consequences are, which I don't think we know. I think there has to be some research done to figure that out and how to talk to moms in particular. Because as Anthony said, they're the ones making the choices for their families. They're the ones doing the shopping. We also have to figure out how to link them to those of us who want to make statements back to the companies and back to our government, who is the one that is supposed to be protecting us. And we have an important role to play in explaining that that's what our agencies are for, and they need to be empowered to take closer looks at advertising so that parents can do what they need to do to raise their kids without that sort of interference. So we have to do both. We have to figure out how to talk, and we have to point them in the directions and connect them to each other to do things. And there are groups who are doing that. Moms Rising is doing that. The Food Marketing Work Group is doing that. There are people around the country who are really concerned about this and getting together, sometimes through schools and through the engagement they have with the school food programs and things like that.
Rodney or Anil, you want to talk about how you would apply based on your experience in schools?
I think what we're doing, what I see that's important, Bill, is in school food service, there's no marketing budget. And I constantly tell directors, if you don't tell your story, somebody else will, and you're probably not going to like it. Usually when you hear a story in a school, in the local newspaper about the food service, it's not a good story. And so food service directors all around the country who are doing wonderful things. We have chefs who are now food service directors, or many school districts are hiring chefs. But we don't tell our story. And your perception of school food service is probably the one you had from the 50s, which might not be a bad one, because for me, you know, I could smell the food cooking all over the school. It was cooked right on campus. But a parent, say in their 30s or 40s, might expect to have, you know, processed foods, whereas more and more school districts are trying to get away from processed foods. Little tough because facilities aren't built for it in many cases. I think the important thing that when I think of engaging my peers, and that's who I think of, is they have to tell their story, and parents have to hear that story. We have to be visible out in the community, which we try and be getting involved in everything, showing what it is that we do. You know, there's not many people in Riverside who couldn't tell you a little bit about Riverside's food service program, and that's a testament to the fact that I'm probably the vainest person you'll ever meet.
Bill, I would just add, I mean, you use the term outrage, which I'll substitute activation energy for the Institute of Medicine, I will substitute activation energy.
Yes.
I mean, people get activated either when they see something they desire, which I think is going to be hard in this environment because of the advertising messaging that takes us in the opposite direction, or they perceive a personal risk that they feel is not fair or that can be ameliorated. I think we're going to have to identify ways to have people feel personally at risk to then be able to rise up and actually use the evidence, counterbalance the message, and actually take action.
Okay. We should probably take the next question. Thank you.
Leanne Birch, member of the Standing Committee. I'm from Penn State, and I'm a product of the Riverside City School System. Just thought you should know that, Rodney. I have a question for you, although others could certainly chime in. I mean, one of the things that you talked a lot about the impact on the school food service program and on the kids. I would be really surprised if you hadn't had some impact on the families. If those kids are eating things at school that they weren't eating before or didn't have at home, you know to what extent you might have had an impact on buying habits, eating habits, availability of those foods at home?
I had alluded to it briefly that parents quite often talk to us about the fact that kids are putting foods in the basket or requesting products that normally they wouldn't have in the past, and they're usually fresh fruits and vegetables. In many cases, what we're finding is it's the kids that are influencing the parents, whereas many say you have to go through the parents. Well, kids are doing a good job of changing behaviors for their parents because of what's taking place at school. We saw that, for example, in our own district where we have salad bar in all the elementary schools, and 5 years into it, I get a call from a middle school and the kids want to know where's the salad bar, and we didn't have a salad bar. And we didn't have an intention of putting it in there, and we didn't. that's when we hired the chef, and he developed his line, which we call Fresh Express. But that was a good example where kids came to us and we modified. We hadn't thought it out, quite frankly, that what happens after they're out of elementary school. But we had truly saw where we had helped develop eating behaviors, and the kids had desire for those behaviors beyond that, and then we reacted to it. But we're often, as I said, involved in the community, and one of our partnerships, our nutritionist teaches nutrition education. The PE teachers donate their time to teach family-oriented physical activities, and then we provide the salad bar as a meal, because many times the parents don't really know what the salad bar is, and when they see it, they're really blown away by it, blown away by the fact that their kids make these choices.
Thanks.
Okay, thank you. Anybody else want to comment? Okay, right over to my right.
Hi, my name is Zoe Stahl. I'm an intern at National Consumers League and a student at the University of Michigan. And I was wondering, Ms. Hinkle, you mentioned this overemphasis on weight reduction, which is something that concerns me too.
Overemphasis on what? I'm sorry.
Sorry. So you mentioned this over concern with like weight reduction,
Oh, yes.
which is something that concerns me too. And I agree, it's mostly because of this fear of, fat, but I think it's also because it's something that can be easily tracked, and it's like you can see your progress, it's tangible. So I was just wondering what we can do to shift our focus from weight reduction to healthy promoting behaviors.
Well, as I said, the materials and things that we provide to after-school and out-of-school programs is around health at every size, and especially in the communities that we work in, we try to get the staff and others to have an expectation that even if there isn't a change in weight, there's a change in health behaviors, and so just to keep emphasizing that aspect of things, and also doing some discussion and programming around body image and other kinds of sort of appreciation of, it's more than how you look. It's about who you are and what you do in your community. So those are the types of things that we emphasize, and I think it's inherent upon us as health professionals, as they say, to do no harm. And so one of the things that happens a lot is that a lot of the people who are enthusiastic about these obesity prevention programs can go to the extreme. And so to kind of keep your staff and others in check about what messages they are promoting to young people who are at a vulnerable age in terms of their development.
Thank you.
Yes, and I think we've heard from a number of speakers over the past day and a half where the language and terminology that we use to talk about obesity and obesity prevention becomes very critical to the outcomes that we're trying to achieve. Next person.
Hi there. My name is Rachel Maines. I'm a junior policy associate with DASH New York at the New York Academy of Medicine. DASH New York is New York State's Obesity Prevention Policy Center and Coalition, and I'm also a doctoral candidate in psychology at the City University of New York. My question is for Ellen, Anthony, and Lori. I know there have been some improvements on the industry side with regard to incorporating healthy eating messages and physical activity, positive messages, opportunities, I think Disney in particular, but for the other companies, Viacom, so forth and so on, what more could they be doing, or what haven't they done thus far?
It's a good point. The food companies have responsibility, so do the media companies. And one of the things we've been asking is that Viacom in particular adopt nutrition standards for the ads that they have on their air and on their websites and wherever else. And they have not been cooperating, And we've been trying to raise our voice. We took out a full-page ad in the Hollywood Reporter the week of Viacom's shareholders meeting, and that's still online if people want to see it, trying to encourage them to do that. One of the things they told us early on was that it was the food companies' responsibilities to do that. They weren't food producers, but that if the food companies had consistent standards that they could follow, then maybe they could do it. And of course, now we do have consistent standards, both in the draft version of the Interagency Working Group standards, which provide a terrific guide for companies that want to do the right thing, and also the CFBAI, the Children's Food and Beverage Advertising Initiative that's part of the Council on Better Business Bureaus, now has consistent standards that won't be adhered to until 2014, but nonetheless, they're on paper, and so they could, and they're a little bit better, right? And so they could, there's a starting point, so it's absolutely something that we think they ought to do.
I might add also that another approach than going to the media companies that are actually the delivery systems, like Viacom and channels and networks, is to go to the production companies, because one of the things we know is the power of media characters, and many of them are television characters. And go to the people who own those shows and produce those shows. And I don't think there's been much of an attempt to organize that group to talk about only putting their media characters on healthy foods for children, because we know the power of media characters to influence children's food choices.
Separate from the media aspect, but I think an important issue that is not maybe fully recognized or adequately monitored is kind of the trust but verify approach with corporations when they make a public statement of commitment, to make sure that that is followed through. Having been close enough to some of these decisions, frequently it is the intergovernmental affairs and the communications group that's making the decision about the public commitment, sometimes independent from the operational side of the corporation that may never figure out how to fulfill the commitment that was made publicly. And that is a corporate responsibility, once they make that commitment, that needs to be verified as followed through regardless of what the expense is to the corporation.
And I think that's what the CFBAI, as Lori has said, not only are there standards that are out there, albeit a start, certainly there is a similar commitment to be able to track and monitor the commitments that have been made to ensure compliance. So more to be heard on that subject. Thank you very much.
Thank you all.
Pat?
Pat Crawford, UC Berkeley, member of the Standing Committee. 2 quick questions on the how. The first one for Anthony. This has been the decade of obesity. It's been a big priority. Now, you know, the interest is waning somewhat. How does the Ad Council decide what health issues rise to the top? So that's the first question. And the second one is for Rodney. There's a group of parents in your district that we all are really concerned about, that are in districts across the country, that never show their faces in the school, or at least very seldomly. It's hard to reach those hard-to-reach parents. And you made the comment that you're out there and people know about what you're doing. And so for those parents, I'm just wondering, how do they know? How did you reach them? So the two houses.
So we're going to start with Anthony first, or?
Sure.
Yeah, okay.
Yeah, I mean, I think you're right. It has been the decade of obesity. You know, we have an advisory committee at the Ad Council, independent group that helps us identify issues that are on the forefront, and they're actually the folks who brought this issue to our attention back in 2000, and then we sought out the most appropriate partners to bring in to help us execute messaging around that. I think we'll continue to message in the obesity space as long as there is a will and support from organizations that want to continue in that message environment. We'll continue to work with our advisory committee to identify emerging issues. You know, we currently have some efforts in the works with the American Heart Association around high blood pressure. This is primarily for adults. We have stroke awareness, some other heart disease messaging. But we also are, you know, the way that campaigns come onto our docket is not only through the advisory committee, but through organizations that feel strongly about the need for communications around a particular issue. So they come to us with proposals and ideas, and then we evaluate them based on our model to see what makes the most sense.
What we did first and foremost was hired a marketing person. which we call a program supervisor, but her job was really to teach us how to market our program, how to do outreach. And some of the non-traditional ways, I mean, we do everything from putting information up on the school marquees to robocalls to the house websites, but what about those that don't have computers and what have you? We've gone out at the first week of school, we have staff in the front of every school there to help and give information to parents. When we're registering kids in the middle and high school and they have their spirit days, we're there giving out water and fruit and talking about our program. Just recently, the district was highlighting programs for the summer. We were out there talking about what it is that we do. So there are many times when it's after our traditional employees' work period or even work day that we are out in the community trying to make sure that we have a presence, that people are aware of the work that we do. And it seems to be working, you know. There probably is a group out there that we're not doing well with, but you better believe that we're trying to identify them and look for ways to reach them.
Thank you. We have time for one final question, and what I'd like to do is to have the panelists remain here after the prepared statements have been provided so that we can get any of your reaction to those statements. Go ahead.
Hi, Leonard Kish. I write for an online publication called hl7standards.com, and I have a digital media company called Vivify that does engagement strategies for healthcare organizations. I actually came out here for a patient engagement conference that was happening this week, and there was a lot of talk there too about culture, and so thanks to the Institute of Medicine for putting this on, because this is exactly the kind of conversation that needs to take place, I think, to fix healthcare broadly. My question is cultural, and I think it's to Anthony. You mentioned that some parents were concerned about the need to spend more time creating healthy foods and dinners. Is part of the problem, or have you seen evidence that with two parents working, that there's just not enough time? Does the time spent with children lead partially to obesity?
Yeah, I mean, I think we've done limited research, but a lot of what we did uncover is obviously we all live in the same culture generally here in the U.S., regardless of what community you live in, and I think we all know the demands on our own time. Work, if you have kids, making sure they're doing the right thing, the education environment, and the challenges that we know we have there. And so there is limited time to spend with your kids, there's limited time to prepare meals at home. So we live in a convenience culture. That's something that we're up against. And the time that we do have, I think what we've found with parents is that they don't want to spend that time butting heads with their kids and trying to be inflicting more rules. So it's easier to just sort of give them what they want. So what we try to do in the message space is show them that there are opportunities to spend that time that you do have in a healthy way that's also fun, that will help them become healthier kids, but also keep them very happy. And then also, with the kid-directed efforts, show the children that there are messages out there that encourage healthy food, that healthy food can be fun, enjoyable. You can create that demand so that the time that the mom and their kid are shopping in the supermarket isn't spent, with the kid pulling on their pant leg to get some unhealthy food, but for the more healthy food.
I might just add, I think the time parents have to spend with kids are an outcome of the environmental change and the pressures that families are feeling on their existence. I mean, having two parents work is frequently a requirement, or having one parent work one or more jobs is a requirement. The loss of local sports leagues for after-school activities is an environmental change. These things have happened over the last 20 or 30 years that lead to that imbalance on calories in and physical activity burning calories off, and that then in turn leads to the epidemic that we have now.
Great, thank you. Thank you so much for that. At this time now we're going to switch to our comments from the floor. We have Joy Spencer. Is she here? Okay, Joy?